May everyone on your route today drive politely. 919.
91.9 FM. Hiya, Joburg Stanton. 14 minutes after 1. Today on Medical Mondays, powered by First Care Solutions, we're tackling one of the most and one of the biggest issues in South Africa, healthcare access in undeserved areas and what the National Health Insurance might mean for the future. Joining us, Dr. Steve Holt from the Group CEO of First Care Solutions. Dr. Holt, you're part of the furniture now.
Hey, Paul. How you doing?
Well, thanks. How are you?
Top of the range, thank you.
Top of the range. I've never heard that before.
No, I'm very good, thank you. Looking forward to Monday today.
Yeah. Always, right?
Good.
Just quickly, I've asked everybody's opinion on this. Let's just talk about the sports for just a second.
Oh man,
what happened?
What a game! What a game! I was presuming talking about the rugby.
Part of it, yes.
Cricket, EFC. Rugby, sure, was a bad weekend.
I don't know.
That first 20 minutes, I'm still enjoying the first 20 minutes of the rugby. I forgot the last 60, but the first 20 were fantastic.
Yeah, the Russies was a very colourful speech.
Yes.
After that.
I wouldn't have liked to be in that change room.
No. But he did say in that speech, he did talk about it starts with the coaches.
He did. Russie's a great leader, whether we like it or not, or like him or not. He's a great leader and he's achieved great things. So whatever he says, I kind of take as gold.
Agreed. Let's jump right in. Dr. Steve, when we talk about undeserved areas, what does that really look like in South Africa today?
Paul, it's a great question because NHI is trying to achieve something to try and create equal access for people to healthcare.
Yes.
And it's a very noble and very necessary thing that is trying to be achieved. The underserved areas in South Africa, by definition, are those areas that do not receive equal access to healthcare. And it's a huge challenge because geographically our country is vast.
Yes.
The services that are available in or outside of the metropolitan areas are limited. And I grew up in a small community and I know what that is like firsthand. And when we look at the people who live in underserved areas, they don't have access to many things, not just healthcare, whether it's water or electricity, whatever, housing. So it is a proper challenge to try and achieve what the noble NHI is trying to achieve.
I mean, what are the biggest barriers to accessing quality healthcare in these communities?
So currently, the biggest barriers are they start long before healthcare. So the basics of education, water, electricity, housing, those kinds of things are needed in order to get access to healthcare.
Yeah.
And I think what I'm hopeful of is that we can somehow leapfrog some of those things with what is happening with technology to try and get healthcare in a different format to more people at a price that is affordable. Yeah. And that, I think, comes with technology, and technology has its challenges. You need data, you need Wi-Fi, you need access, those kinds of things, and those conversations are all happening. So I'm quite excited that, like the cell phone, a lot of people never had fixed line telephones. They just went straight to cell phones.
Yes.
I'm hoping that technology can enable healthcare to more people more often.
So they often talk about the most primary thing in terms of, for example, the media is the radio, which people in these rural areas have. How, and this is something, I'm going to go a little off topic here because it's something that I'm trying to understand. How do you, as a massive company like this, how do you breach the gap from completely rural to having and supplying technology?
So the infrastructure needs to be there and the regulations need to sort of enable that.
Yeah.
I think what we're seeing now is that there's a huge push in the country to try and get coverage, whether it's satellite or everyone's talking about Starlink and there are others as well.
It's a big thing right now.
If we can get proper coverage, proper data coverage across the country, I think it just opens up the playing field entirely
Absolutely.
to say we now can deliver virtual healthcare, whatever that means, not only in the format that I believe, but in sort of other formats, referrals, organization, of patient movement. So you're getting appropriate use of resource in area and then appropriate referral to a sort of higher level of care.
Is that a definitive timeline, or in terms of supplying, let's call it Starlink for whatever reason? Like, what does that timeline look like to you? I mean, is it indefinitive, or if that's even a word?
I'm not sure that's a word. That indefinite maybe is
yes.
I think, look, I think if the regulations enable it, I think we'll have Starlink everywhere. It's not something that is difficult to roll out. I don't think. I mean, the availability is there. It's in many of our neighboring countries. So why shouldn't it be? And if we can get that, then suddenly the playing field becomes. It just enables so many things, but we can't really do it at this stage. Okay. And I must say, Starlink's not the only people. You know, you've got other big telcos that are trying to do similar stuff.
Yes.
And hopefully whoever does it gets it out there soon. The sooner the better.
Okay. I mean, NHI has been this hot topic for like a long time. In simple terms, what is it aiming to achieve?
So NHI, national health is not a new thing, not in this country, not sort of in many other countries. National health means that everyone has access equally to the healthcare services in that country. And at the moment, we know there's a private sector and a public sector in South Africa, and those resources are not distributed equally.
Okay.
So NHI is trying to enable equal access. And I think, there's a number of very hot potatoes we could get into here, but I think in general, the principle is noble. But it's not something, like many things, that you can just turn on tomorrow.
Yes.
And there has to be a constructive and a well thought through plan to implementing national healthcare. The biggest piece, though, is where does the funding come?
Yes.
Because you can't just take from one area and put it in the other and think you'll get equal access, So I think the numbers that are being bandied around, South Africa just can't afford national health in the format that is being suggested. But it doesn't mean that national health can't start somewhere.
No.
And that's where I get excited, because I think, aside from sort of the efficiencies and the learnings that potentially private healthcare can bring to public healthcare, there are so many digital efficiencies now that come to the fore. And you could turn on NHI in a format of virtual healthcare to enable primary healthcare access to everyone at a fraction of the cost.
Yes.
And that is something that I do think, and I will be pushing for, whether it's from our business or others, we need to get digital healthcare into those underserved communities to enable them to have better healthcare.
In terms of how could NHI improve healthcare access for people in the rural and low-income areas?
Well, primary access to information is the first thing. So if we've got data coverage all over, and most people these days, and I say most people, smartphone penetration in South Africa is massive.
Yeah.
So by having data that's affordable to those underserved areas, education becomes an enabling piece of NHI, because you can start telling people about HIV and TB more efficiently than you can now. You can start to measure those outcomes. You can start to give information about vaccinations. You can start to coordinate stuff using the new technologies like AI, and making sure all the clinics have medicines available and that sort of thing. So I really believe that the digital efficiencies will get more people covered with what's there.
Yes, of course.
Then you can add the overlay of virtual healthcare, which becomes, it's not just talking to a doctor. Virtual healthcare is a myriad of things.
Yes.
And if you can, virtual healthcare can help coordinate care better. It can make sure people are compliant with healthcare. Taking TB drugs you have to take them for months and months and months and months. And having virtual healthcare support that is critical to getting people healthier.
I mean, critics are obviously raise concerns about implementation. From your perspective, what are the main challenges that the NHI faces at this point?
I think, politically, NHI is a hot potato because there's so many, big players talking and arguing about whether or not it's the right thing or the right thing right now or how it's rolled out. I don't think anybody will question that it's the right thing to do.
Yes.
The question is how to do it. And first and foremost, they have to decide how to do it, and then they have to find the money to do what they've decided to do. Once they've decided to do it, well, then you've got all the operational challenges that go with it, and finding enough staff and finding enough physical locations.
Yes.
But I really think because this accelerated digital age is now happening, that people need to be aware that they can actually make a difference quickly without bricks and mortar necessarily, or without remote staff and all the costs that go with that.
I've always wondered. So if we're implementing NHI on this massive scale, at what point do we have the infrastructure to keep up in terms of education of doctors? Does the education change? Do we provide future doctors a simplified version of the MBCHB, or do we just continue because we've got a very high quality of doctor turnout in this country? Do you take that away, or do we just simply provide doctors as per usual?
Sure, that's a really broad question, but it's a great question. And already there are a lot of changes that have happened in the universities that I'm aware of. I'm not an expert, so I don't claim to know everything. But I think over the years they've definitely increased the training in the sort of primary healthcare environment. They've also created new roles for things called clinical associates. People called clinical associates. Clinical associates are specifically trained to work under doctor care, and it's a 4-year degree as opposed to a 6-year degree.
Okay.
And they are trying to get more staff into the marketplace.
Yeah.
The challenge that's currently being faced, and I know they're busy trying to address it now, is they're rolling out loads of new doctors, but there are loads of new doctors who don't have jobs because they can't be accommodated within the state system because certain places don't have the budget.
Okay.
So we have to, money always starts the conversation because we have to be able to afford to pay those people.
When we come back, we're going to take a little music break. We're going to talk a little bit about how technology like telemedicine can realistically close some of these gaps. We'll do that in just a little bit. If you have just tuned in, it's a very good afternoon. Welcome to the Midday Exchange. It's Medical Mondays, powered by First Care Solutions with, I saw it on your keychain, the man, the myth, the legend. So we'll do that when we come back. We'll be chatting to Dr. Steve Holt. 91.9, it's Bruno Mars. 24K Magic. Powered by First Care Solutions, we are chatting Medical Mondays with Dr. Steve Holt. Let's just jump in there. This next question, and I always like, because I love the services you guys provide. And this was a really, really good question. I took some time more than usual, actually, to talk about these questions. How does First Care Solutions approach healthcare access differently, particularly reaching people who normally just sort of slip through the cracks?
Yeah, it's a great question. It's a very difficult one to answer. So we certainly support the concept of NHI, firstly.
Yes.
So we believe that there should be equal access. As a business in South Africa, I can't create equal access in bricks and mortar, and I can't do that.
Yeah.
But what I can create is a platform that people can utilize to access good healthcare in the primary environment. Well, that's where we're starting anyway. And as the tools get better, the digital tools get better, we can start to extend those services more and more and more. And already on our platform, the Care First platform, we've created There's a facial scan that just takes a video of your face doing using photoplasmography, and together with AI can actually measure blood pressure, pulse, respiratory rate, all of those things, and even some of the biomarkers like hemoglobin, cholesterol, those kinds of things. And that enables already, for example, the monitoring of a hypertensive or the monitoring of a diabetic remotely that potentially wasn't being able to have access to that kind of monitoring before. So we believe that the digital tools are enabling people's access, and we've added skin now as well. You can take a photograph of any skin lesion and get an answer or speak to a doctor about it.
That's wild.
That is really, really cool. And it's a fraction of the cost of doing that through a sort of bricks and mortar structure.
I mean, can technology like telemedicine, mobile clinics, realistically close some of these access gaps?
Yeah, I think they can, and I think they will, and hopefully they will. You still need those things. So digital or virtual healthcare is not going to be solving every problem.
Yes,
but it can certainly help solve some of the problems. And you know, everyone's got that picture in their mind of the sort of government clinic with the long queue outside. Those queues could be better managed. Those you know, taking 20, 30, 50% of the people out the queue and leaving them at home to do their virtual consult, much more efficient than you know, the queues. But you know, you've still got vaccinations, you've still got circumcisions, mammography, all of those things that need to get out there that need physical infrastructure to do.
Yes, of course. In terms of, I mean, I know we touched on this, and you mentioned at a university level, you're talking about a 4-year degree. Realistically, will we have enough trained healthcare professionals to support the vision of the NHI, especially in the rural regions?
We're certainly quite a few short at the moment, and you know, South Africa is a net loser when it comes to healthcare professionals because we lose so many to international opportunities. We see them go every day, which is sad.
Yeah.
But if we can create the environment for those healthcare professionals to work in the rural areas, then certainly that will help. And the money discussion comes in. People want to earn a good living and have a safe and happy life out there.
Yeah.
But things like, you know, the degree clinical associates is being specifically created by government to help fill that gap. It's a 4-year degree. It's really the graduates that come out of there are really top notch.
Yeah.
They're able to do consults, limited prescribing, procedures, all under the guidance of a doctor. But you can imagine that, you know, a 4-year degree as opposed to a 6-year degree for medicine, you can churn out a lot more people in that time.
Of course.
So I think we can get there. But all of these things, the rollout takes time.
Yes, of course. Absolutely.
And I just think the trajectory of that rollout, now that digital is a real opportunity, needs to be considered highly before we just look at doing it in a traditional way.
Yes.
Yeah. So as long as it's being considered and the regulations enable that and we get data out there, sure.
The possibilities are endless.
They are.
If or when the NHI is successful, what does South Africa's healthcare landscape look like in 10 years from now, give or take?
My view or the populist view. So I think
there's diplomacy, is everything.
Absolutely. I'm very diplomatic. I think if digital and technology is really embraced by our country, I think we can see a cost-effective NHI rollout, at least in part.
Yeah.
But it's got so many hurdles to get over because it was positioned as one thing, and you can't get to the next phase until that one thing, which is primarily the numbers and some of the terms and conditions around the involvement of medical schemes and what can and can't be offered and those kinds of things. Sure. There's so many legal suits against NHI at the moment. I can't really see material rollout in the next 10 years unless things are solved amicably now. And again, what I would like to see is that if digitization is embraced, our population understands digital. They understand cell phones. That's all you need to get a huge chunk of NHI out there.
Yeah.
And that, I think, ticks a big box for NHI at a low cost.
No, I completely. It's just, and that's what we've always said, that technology is, if you're not going to embrace technology, you're going to get left behind.
Yeah. Can I just say something about technology? So historically, new technology in healthcare usually pushes up the price. So when it comes to fancy machines and robotics and all those kinds of things, it pushes up the price because it's so technologically cutting edge. The R&D that's gone into that is massive. But that's a sort of small segment at the top end. What I'm really talking about now is the bottom end of the pyramid.
Yeah.
Not only of people, but of services to people. Primary healthcare is enabled by digital at a much lower cost than it would be at the top end of the pyramid.
Agreed.
So for the first time, technology can help bring the cost down rather than push it up.
Absolutely. And finally, for our listeners, what's the one thing us as South Africans, what can we do as ordinary South Africans to support better healthcare access in our own communities?
Look, I think we need to get technology enabled as a culture within our country. That means that the regulations have to enable data coverage. I say data coverage, you know what I mean. You have to get coverage. Everyone has to have access to good data out there. And whoever can encourage that is doing a good thing.
Of course. We did have a question. I want to just throw one at you quickly. Got a question during the course of the interview from Bianca. And Bianca said, Dr. Holt, will NHI mean longer waiting times?
It depends on how it's coordinated and operationalized, because waiting times for what? Waiting times for a hip replacement or waiting times for a consult with your GP. I think all of those things can only be answered in the operational rollout.
Yes.
Certainly, what I envisage is that those long queues of people that standing there to collect their HIV medicines or antihypertensives, that can largely be digitized.
Yes.
And I think those kinds of things should shorten queues.
I agree.
The other side of the coin, though, is that an effective system will probably pick up more of the kinds of illnesses that need to be picked up, and people need surgeries and that sort of thing that potentially just never got them because nobody knew about them. That may cause more queues, but that can then be planned for and thought through, and we can start training people to do cataracts and hip replacements and the high-end stuff that currently does have a queue.
100%. For those who want to try out virtual medicine, where can they go?
Well, it's very simple. You just go to www.carefirst.co.za.
There you go.
Register. It's free. And once you've registered, have a look through the system. You can try it out. It's really fantastic for primary healthcare stuff. We can help you.
Amazing. Dr. Holt, thank you so much for your time. I've learned a lot today. I came into this with an idea, and you have given me what appears to be a large amount of hope for our primary system. Dr. Holt, thank you so much, and hopefully we'll chat soon.
Brilliant, Paul. Thanks so much again.
The Midday Exchange.